Hi, I'm Dr. Eric Smouha from ENT and Allergy Associates. I'm a neurotologist, that's an ear specialist, and I've been doing this specialty for many years. Today I want to talk to you about Meniere's disease. Meniere's disease is a common cause of vertigo, and it's caused by excess fluid production by the inner ear. So the inner ear is a complex organ of hearing and balance, and the inner ear normally contains a small amount of fluid. In Meniere's disease, too much fluid is produced, and that's what causes the symptoms. People with Meniere's disease have attacks of vertigo, and that's what's troubling for them. But they also have hearing loss and ringing and pressure in the ear.
So I've been dizzy for about 3 years. I've been told it's Meniere's disease, and I've been told to take Antivert, but it doesn't help.
Antivert is a good drug for treating the vertigo attack when it occurs, but it's not a good drug for preventing vertigo attacks from occurring in the first place. So in Meniere's disease, what you want to do is follow a low-salt diet and take a diuretic, a water pill, to prevent that fluid production of the inner ear that causes all of the symptoms.
Great. So I'll take the water pill. What should I do if I still have vertigo?
There are other treatments. If the water pill by itself doesn't work, we often inject cortisone into the ear. And when people are having a flurry of attacks of vertigo and they're having a bad time, that usually puts the problem to rest.
So I've gone to physical therapy, but I still have the attacks.
Physical therapy is often prescribed to people to help maintain their balance between attacks, and it's very helpful for that, but it doesn't prevent the next attack from occurring. So we have medical treatments, and we try to individualize it for each patient, and different patients respond differently, but most patients, we can control the vertigo.
Can I expect my hearing to come back? And what about the ringing in my ear?
The hearing is less predictable. In patients who've had Meniere's disease for a long time, the hearing loss can be permanent. In patients who've had it for a short time, the hearing often comes back if they're treated early with medication.
Awesome. What can I expect in the future?
The main problem with Meniere's disease for patients is that it can be unpredictable. People often go into remission, and sometimes for a long time. And the longer you're in remission, the better the odds are that the disease is in control and won't come back. But when vertigo attacks recur, despite treatment, that's when we do injections.
Is there a surgery for Meniere's disease?
That's a good question. We rarely do surgery anymore, but we used to do it a lot. Nowadays, the injections are better for controlling long-term problems, but surgery is reserved for patients who don't ultimately respond to medical therapy or who fail medical therapy.
Awesome. Thank you.
Thanks for listening.